Aloha, this is Neil Strassberg. Welcome to the Anxiety Coach. Ketamine infusions in 5 minutes or less. Can it be done? Let's find out. I had 6 infusions so far, so I can't give a full accounting because I haven't yet had any boosters, but I will say there have been no need for any boosters at all, which is a very, very good thing. What it's like is peeling emotional layers. For me, that's what it was, one at a time. I started to feel a little bit better after the first infusion, but it wasn't dramatic because my SSRIs were really helping, let's say, 50% with anxiety, depression, and PTSD. So there wasn't this great need to have a weight lifted. I did feel a little better, but after the second, the third, the fourth, I started to really feel lighter, and the absence of the anxiety and depression, it just wasn't there. It's not about being high, it's not euphoria, it is the absence of what I've been wrestling with. And after the 6th, having had a couple of very deep sessions with my therapist teacher, who was gracious enough to come with me, we cleared away a lot of cobwebs, not just the anxiety, but some stuff lying underneath, having to do with attachment and wounding below that from childhood and things like that, things to do with relationships. My mom, my dog was very close with me. And this is, I think, 5 to 6 weeks post first treatment, somewhere 2.5, 3 weeks post 6th treatment, and I am doing so good. I can't say enough about it. I'm not going to come out as a full-on proponent of ketamine until I've had 90 days post-treatment, but it's looking like it's going to go that way. What does it actually feel like? Somewhere in the 15-20 minute range. It's kind of like a soothing sinking into the chair or bed, and you start to lose the will to talk. You don't really feel like it. It's just not necessary. You want to kind of go in. And for me, it's dissociative in a good way. I have a lot of experience with this from holotropic breath work and some psychedelic experiences. For me, I call it entering the void or 0 point, where you're outside of space and time. The things that haunt you and you wrestle with in day-to-day life just aren't there. It's like a coming home. It feels like you're home in your heart, or home with your soul, or wherever you were before you came to this place, and wherever you're going after, it's like you're there. And I wouldn't say there was full-on hallucination. Sorry. I did see things like moving from space to space, similar to a room where everything was undulating in a diagonal, perpetuating spirals. Perpetual motion, and I was part of that motion. I was part of everything. Everything and everyone in the room, from the air conditioner to the IV machine to the music in my headphones to what went on before I got there, was all part of each journey. I brought a lot of fear into the first journey, like most of you. I didn't know what to expect. I was worried that I would have trauma, like in some of the wilder breath works, but it was a corrective experience. The first one, it brought me back to my heart. I couldn't be safer. I had my therapist there, a trained certified nurse anesthetist, and it was like I was back on the mat in Hawaii or Taos, New Mexico with the breath works, but a corrective experience. It took away all the fears and sort of the nightmarish memories from what went on for me 18 months ago when I had to leave the breath work. I do recommend it. I'm going to hold off being a full-on proponent. It was a very positive experience for me. I personally didn't have anxiety during the sessions, but some of you might worry about dissociation. For me, it was a sort of a beautiful, lovely place to be. Some of you might be fearful if you haven't visited that kind of state before, but they do have nausea medication that's very effective. They can pre-medicate you, and the same for anxiety. I forget what it's called, but it works in 30 seconds flat through the IV. So you can pre-medicate, but if you do, you won't really go on a journey. You'll be kind of really sleepy and won't remember anything, which is fine for treatment, but I'm a strong proponent of going deeper. That's why transpersonal coach. beyond and outside just the anxiety in the body-mind. So we're hitting 5 minutes, so I'm going to sign off. The bad, sorry I didn't cover the bad. This channel is all about the bad. There really was only some light side effects, a little bit of insomnia. There was increased libido. I can't say that's negative. And a little bit of memory loss, a short-term memory loss, which I still don't know if it's the ketamine or the SSRIs, because I'm still currently going through withdrawal symptoms, a lot of brain freeze and insomnia and short-term memory loss. So at the 90-day post update, I'll let you know if my short-term memory has leveled off or come back. So that's almost 6 minutes. So to answer the question, can it be done? No, it can't. This is Neil Strassberg. Mahalo for watching The Anxiety Coach. Please, my hand on my microphone, allow me to encourage you to do something empowering today. We'll see you soon.